Good morning. Today I will give an update on the COVID-19 situation in Prince Edward Island and clarify some issues related to travel, masks, vaccine, and discuss holiday gatherings. And since it's December 1st, I'd like to provide an update on Santa and the elves. I'm pleased to report that there are no new cases of COVID-19 in PEI to announce today. We continue to have 4 active cases that are all self-isolating at home. We've had a total of 72 cases since the pandemic began. Regarding the cases announced on the weekend, one was a student at Charlottetown Rural High School. Since we became aware of this positive case on Saturday, our office has been working closely with staff at the Public Schools Branch and Charlottetown Rural High School to conduct contact tracing and support a safe return to school. I would encourage all teachers and students with smartphones in PEI schools to download the free National COVID Alert app. Currently in PEI, there are 102 people in self-isolation as a result of being either a positive case or close contacts of a confirmed case of COVID-19. We've also received interjurisdictional notifications for islanders who have been identified as a close contact of a case in another province. There are currently 6 interjurisdictional referrals in self-isolation. I know that there have been questions about our recent 2 cases. One returned from travel outside Atlantic Canada, and the second case, while the individual did not travel, is still under investigation and is likely linked to contact with someone who traveled off Prince Edward Island. As always, we will continue to update Islanders as we know more. In Canada, there have been over 378,000 cases of COVID-19 and over 12,000 deaths, with 38,386 new cases reported in the last week alone. This represents a 13% increase from the previous week and an average of 5,484 cases per day, and that's also up from the previous week. Alberta cases are up 37% this week, Saskatchewan is up 17%, Ontario is up 11%, Yukon is up 220%, and Nova Scotia is up over 300% from the week before. Nova Scotia has 138 active cases, New Brunswick has 120, and Newfoundland and Labrador has 36 active cases. It is not surprising that in Canada, hospitalizations are up 15%, and ICU admissions are up 24% compared to the previous week. Deaths have also increased. During the past week, the largest number of outbreaks in Canada were reported in long-term care and retirement homes, and schools and childcare centres, with 164 new outbreaks reported in long-term care retirement homes and 105 new outbreaks in schools and childcare centres just in the past week. In recent weeks, the incident rate of new cases is highest in those over the age of 80, as well as those in the 20 to 29 age group. The rising case counts across Canada are deeply concerning. We know that health systems are strained in many jurisdictions, having to make decisions to adjust services to meet the demand for care for seriously ill patients with COVID-19. Last week, we announced PEI's decision to temporarily suspend participation in the Atlantic Bubble. It was effective Tuesday, November 24th, for an initial 2-week period. This decision was made in order to balance the risk of importation of COVID-19 and protecting the health of Islanders with supporting our economy and minimizing societal disruption. We do want life on PEI to continue as normal as possible for as long as possible during this pandemic. This change means that travelers to PEI must apply for pre-travel approval and self-isolate for 14 days. Island residents need to self-isolate or work isolate for 14 days when returning to PEI after travel. We are urging PEI residents who are temporarily living off island, including students, and all who are planning to return to PEI for the holidays to apply for pre-travel approval and identify holiday travel for island residents as the reason for travel. Knowing in advance how many Islanders will be traveling home for the holidays allows us to plan for staffing and will expedite screening at the points of entry. Thank you to the 158 individuals who have already applied under this category. Since PEI suspended participation in the Atlantic bubble, there has been a sharp decrease in non-commercial traffic to PEI. For example, from late October until last week, there was an average of 1,120 personal vehicles crossing the Confederation Bridge per day. Since the change, that number has dropped to an average of 225 personal vehicles a day. There has been an increase in the number of Islanders applying to be rotational workers and others applying to work isolate. The weekly average of applications for rotational workers has doubled to 71, and the weekly average of Islanders applying to work isolate has jumped from 16 to 177. To date, we have received approximately 400 total applications for travel under the Family Connections and the Holiday Travel for Island Residents categories, so that includes 150 individuals I just referenced. It's not surprising to learn that since PEI temporarily suspended participation in the Atlantic bubble, fewer people are traveling to PEI and more Islanders are taking advantage of the opportunity to work isolate. I would like to clarify the rules around same-day travel within Atlantic Canada. PEI residents who travel back and forth to PEI in the same day for medical reasons, child custody, airport drop-off, or picking up a student who do not stay overnight are exempt from self-isolation. This exemption is provided with the understanding that interactions are brief and physically distant, and that travel does not involve shopping, visits with friends or family, or stops in public places. This exemption allows Islanders the freedom to travel to same-day medical or dental appointments and other essential travel within Atlantic Canada without having to self-isolate. Masks are mandatory in public places, including but not limited to retail outlets, restaurants, except when eating or drinking, places of worship, public transit, buildings that provide public services, and common areas of public buildings. Masks are most effective when worn properly. They should fit snugly and comfortably over the nose, mouth, and chin. Masks are another layer of protection, supplementing but not replacing other important public health measures, including physical distancing and hand washing. Islanders are demonstrating their caring towards others by wearing masks. Our office has received reports of very high compliance with mandatory masks. It's important to remind ourselves that my mask protects you and your mask protects me. Very few people cannot wear a mask for medical reasons. These reasons are not always visible. I ask Islanders not to judge or shame people who are not wearing masks. The prospect of having access to a vaccine for COVID-19 signals hope. There may be an end in sight to this pandemic. Although no vaccine has yet been approved for use in Canada, Health Canada has received submissions for the COVID-19 vaccines. PEI continues to participate in discussions with the federal government and other provinces and territories regarding details around vaccine allocation, distribution, procurement, and logistics. Our PEI team is working with partners here in Health PEI and across government to develop a plan to receive and distribute the vaccine. We are expecting to receive small amounts of the vaccine initially, likely within the next month. And although it may take many months for all Islanders to be immunized against COVID-19, I know we're all looking forward to starting to immunize Islanders. While we are expecting vaccine to arrive in January 2021 in this province, it will take time to have everyone vaccinated. PEI will be following the national recommendations for priority groups to be immunized, but all Islanders who want the vaccine will receive it over time. I am confident that PEI will be ready to receive, administer, record, and report on vaccine as soon as it arrives in the province. When the dates of arrival of the vaccine and the actual number of doses of the vaccine can be confirmed, we will be letting everyone know, and we will share this information with Islanders as soon as it becomes available. Later this week, we will have some initial information about the COVID-19 vaccine and its administration available on our website. The holiday season will be different this year, as we will all find ways to reduce the risk of transmission of COVID-19 and celebrate the holidays safely. I urge Islanders to not travel off-island over the holidays. I urge families, including students who live off-island, to consider not coming home for the holidays, and that's hard to say. Family members who decide to travel to PEI over holidays must seek pre-travel approval under the Family Connection stream and be prepared to self-isolate for 14 days when they arrive in PEI. Celebrating with people outside your immediate household also brings additional risk. As much as possible, I urge Islanders to keep holiday gatherings as small as possible. Levees are synonymous with New Year's in PEI, and this type of social gathering is not recommended for the upcoming holiday season. I hope that next year we are all able to resume this long-standing island tradition. If any group chooses to proceed with a levee, they must develop an operational plan in accordance with the gathering guidance and respect all public health measures, including physical distancing and masks. Holiday guidance will be posted on our provincial COVID-19 website by the end of this week. And now that it is December, I know children and their families are anxiously waiting to see if their special elf is going to appear. And I received a special alert this morning to tell me there is no COVID-19 in the North Pole. Santa Claus, Mrs. Claus, the elves and the reindeer are all safe and healthy. They know that COVID-19 has been very hard for children and families around the world. And pre-approved travel has been received for Santa and his elves to come to PEI. The alert I received also said it's safe for the elves to travel back and forth to the North Pole each night. Your special elf and everyone else in the North Pole are protected from getting sick from COVID-19. However, Santa is reminding every elf to remain at least 6 feet from everyone and pay extra careful attention to washing their hands. I will say that our elf arrived at our house this morning, and my youngest son told me before I left for work that I shouldn't worry. Little Elfie is very careful as a rotational worker, and he's part of our December household bubble, I was informed. I continue to be concerned and worried about the COVID-19 situation in Canada, including Atlantic Canada. While we are working diligently to remain in the new normal phase, we have to be prepared for the possibility of further restrictions in terms of gatherings and access to services. Our actions over the next few weeks, especially over the holiday season, will determine what the remainder of our COVID-19 journey looks like. We know there is a vaccine on the horizon, and the finish line is too, but it is off in the distance. We do have to buckle down and follow public health rules and guidance for a few more months. Thank you to Islanders for continuing to do their part to protect themselves and others from COVID-19. Let's continue to stick together and not let our guard down against COVID-19. Please continue to follow the basics, which we talk about every week. Wearing a mask in public places and spaces, wash your hands often, maintain physical distance of at least 6 feet from people outside your household, keep your circle of contacts small, stay home when you're not feeling well. As we prepare for the holiday season, we can be grateful for so much in PEI. We've not had any hospitalizations or deaths related to this virus. Our children are benefiting from in-class learning. Youth can enjoy extracurricular activities and organized sports, and parents can join as spectators. We can attend worship services. We can enjoy a meal at a local restaurant. We can visit our loved ones in long-term care and community care. And we continue to have access to high-quality health services across our beautiful province. As we double down our efforts to limit transmission of COVID-19 in PEI, let us work together. And although it seems like it's been a while since I've said it, it's still true. Let's come together by staying 6 feet apart. And together, let's continue to be patient and let's continue to be kind. Thank you. And I'll turn over to you, Mary.
Thank you, Dr. Morrison. Good morning. I want to start by thanking our staff and physicians who worked tirelessly over this past week and weekend to ensure all the testing and contact tracing that needed to be done was completed as effectively and quickly as possible. I want to say a special thank you to Kelly Rayner, who is our Provincial Director of Primary Care, but has been leading our Health PEI operations branch since the beginning of this response. Over this past week, more than 4,000 test results were completed. The testing clinic staff, Island EMS, laboratory staff, and public health staff who worked together and stepped up to provide these important services to Islanders. I want to say thank you. The Joint Response Team has been carefully monitoring the health system as well for any impacts on our ability to provide services. With the exception of the work needed to be done for testing and contact tracing, we're pleased to say there were no impacts in our ability to continue to offer services to Islanders. We do have plans in place to respond effectively should we see COVID-19 cases rise and see admissions to hospital. Work has been done and is ongoing to ensure we have the capacity for Islanders with COVID who need acute care. Plans are in place to also permit us to maintain as many services as possible, even if and when we see cases in our hospitals. All staff and physicians are closely following the public health guidelines, including the use of appropriate protective equipment, physical distancing, and monitoring for any COVID symptoms. We've been continuing to update our visiting protocols as well based on the public health measures. One reminder I'd like to offer today is that if you have traveled outside of PEI any time within the last 14 days or are under self-isolation, you are not able to visit our Health PEI facilities, including long-term care, until your self-isolation is completed. Special permission and a process is in place for compassionate visits at the end of life for patients or residents if that is necessary. Also, as a reminder, masks are mandatory for everyone coming to visit or attend appointments at any of our health services. Now more than ever, it's important to follow the public health guidelines, keep your circle of contacts small, wear a mask, wash your hands, continue to be kind and understanding toward one another and when attending hospitals or health services. Our healthcare workers are working very hard to maintain the current level of public safety in relation to this pandemic. Together, we can continue to ensure Islanders keep our COVID numbers low and Islanders are safe. Thank you.
Thank you, Marion, and we'll open it for some questions.
Louise Martin, CBC.
Oh, hi, good morning. Thank you to you both for taking our questions today. Dr. Morrison, this one is for you. You mentioned the source of COVID-19 for the student at Charlottetown Rural was likely travel-related or to someone who's traveled off island. So since a lot of people are concerned, of course, about community spread in this particular case, can you expand on that? Did someone travel here from off island and come into close contact with the 15-year-old? Is that person also a current case in another province? Is it a friend, a relative?
Louise, I think I'm not going to give much more than what I've already given in terms of that particular case. It's certainly, as we said, we continue to investigate. We know that the case associated with the school has approximately 70 close contacts that are in self-isolation. And there will be repeat testing done on those close contacts later this week, and I think we've talked about it a couple of times over the weekend too. Sometimes it's a challenge to always link the cases, but we're doing the extra testing, and we've done, as Mary mentioned, a lot of testing. There's no indication of widespread community transmission at this time, and we have a large number of close contacts in isolation, and they'll get retested.
So then how many tests are still outstanding at this moment? And given the volume of testing that's been done over the last few days and the fact that Charlottetown Rural is open, are you confident at this point, as you put it, have wrapped your arms around this particular case?
Well, I think we have the 70 close contacts that are being followed every day. They're being contacted on a daily basis. They will be retested later in the week. And so they're, in terms of outstanding tests, I don't think all our close contacts have been tested initially. And but I definitely encourage, and we've said a number of times over the last days, anyone with any symptoms should be tested, and don't wait a number of days if you have symptoms. Certainly go to get tested, and we will keep people updated day by day as we know more.
Thank you. Rachel Collier, The Graphic.
Hi. I guess my question, it sounds like we really pulled all the stops this weekend to complete all the testing. Was it within 24 hours? But I guess I'm curious, what's our max capacity to react? Like, how many tests can we run in 24 hours, and how many people can we contact trace kind of sustainably?
Hi, Rachel. A very good question. And we have been very fortunate here that we've had a number of situations over the last last 9 months where we've had to respond, whether it's associated with long-term care facility or acute care facility, or case with public exposures, or case in the school. And absolutely, it takes a great deal of work, and Marion has thanked a large group of people, and I did as well over the weekend, to assist in that. And we have a very fortunate good testing capacity here, and good lab testing and contact tracing capacity. And at this point in time, we continue to look at that, but we actually think we could do more if we needed to. And but I'm hoping that doesn't happen.
Okay. And I guess since you brought up the app here today, I'm curious, do you know how many people on Prince Edward Island are using that app, and how many would you like to kind of see download that app?
Well, because it's a national app, there's no way of of us knowing exactly how many islanders have that app downloaded, and that's just the way it's been set up. But and so that's why I would like to see as many people as possible have it. Of course, it only works if you've downloaded the app, and also that the case, if you become a case, you've downloaded the app, so you can put the notification into it and share it with anyone that you've been close to. So it's a good reminder. I think we've been talking about this COVID app for the last number of weeks, for sure, a couple of months, and it's free, and many people do have smartphones that they carry around, and it may be helpful if we start to get more cases.
All right, thanks for that.
You're welcome.
Gabrielle Tounon, Radio-Canada.
Bonjour, Dr Morrison. Alors, une question pour vous en français. Vous avez bien mentionné que l'île, elle avait mis en suspens sa participation à la bulle atlantique. La semaine passée, vous avez fait cette annonce, et cette mesure, elle reste en vigueur jusqu'au 7 décembre, donc la semaine prochaine. On voit que le nombre des cas de COVID-19 est toujours en hausse au Nouveau-Brunswick et en Nouvelle-Écosse. Donc, est-ce que vous prévoyez, en regardant tout ce portrait, est-ce que vous prévoyez de prolonger le retrait de l'île du Prince-Édouard de la bulle atlantique jusqu'à Noël? Est-ce que vous avez déjà commencé à discuter de cette reprise de la bulle atlantique avec les autres autorités de santé publique des autres provinces?
Merci pour la question. Et puis, on a commencé les discussions avec le Premier ministre ici à l'île du Prince-Édouard et aussi on commence les discussions avec mes collègues ici aux régions atlantiques. Et puis, je pense ici à l'île du Prince-Édouard, on va faire une annonce à propos de la suspension de la boule avant la fin de semaine.
OK, parfait. Et toujours au sujet des voyages, vous avez dit en anglais que le Père Noël, il est un travailleur essentiel et qu'il va pouvoir entrer ici à l'île pour distribuer les cadeaux aux enfants pendant les temps des fêtes. Est-ce que vous pouvez répéter cette information en français pour les enfants francophones de l'île, s'il vous plaît?
Oui, bien sûr. Alors, le Père Noël, et c'est et Madame Noël, Madame Claus, ils vont bien. Et puis, ils ne peuvent pas avoir le COVID-19, ils sont en bonne santé. Puis, on a déjà donné permission de voyager à l'île du Prince-Édouard pour Père Noël. Et puis, il va être un rotational worker, un travailleur essentiel, vraiment, à l'île du Prince-Édouard. Et puis, il va faire les visites aux enfants ici, aux enfants et les insulaires de l'île du Prince-Édouard.
Parfait. Merci beaucoup.
Merci.
Alison Jenkins, The Guardian.
Hello. I was wondering, Dr. Morrison, if you could elaborate on the islanders who are in self-isolation because of close contacts from other provinces. Can you confirm just the number of islanders there are and the number of cases they're associated with, and where, I guess, the advisories came from?
Hi, Allison. So there's always a process in place with communicable diseases for interjurisdictional notifications, and they can come from any other province or territory. And that has happened throughout the pandemic, but we definitely have received a few more than since from Atlantic Canada more recently, and that has to do certainly with the connections that we have with our neighboring provinces. And so I think I mentioned there are 6 interjurisdictional referrals currently in self-isolation. I believe we've had a total of 15 over the last couple of weeks. When we get our interjurisdictional notification, they remain in isolation for that period of time, and they are contacted by public health nursing, and we also do testing of those close contacts.
Okay, thank you. It just wasn't clear if it was 6 islanders or 6 notifications. I just wanted to confirm.
These are islanders who were identified as close contacts of a case in another province.
Right. Okay. Perfect. And I had a question for Marion. What recommendations do you have for anyone who is particularly extra nervous about a hospital procedure they have to undergo these days? Can they call someone to get some, advice on how to stay safe? I know that you're always saying that it's safe at hospitals, but how can people reassure themselves?
Thanks, Allison. I think what I would like to say is that we have good screening procedures in place. I give the reminder today that people are not able to come if they have traveled outside the province at this time until they complete their self-isolation, unless there are specific protocols. We've continued to review what procedures are happening and whether those patients who are coming fit into that category of someone who is to be self-isolating, and sometimes those individuals do need emergency or urgent care, and that is provided, and we have those protocols in place where those patients are streamed and additional cleaning precautions and personal protective equipment is available and provided for staff and the area to protect other patients as well. I think for anyone who is feeling anxious about it, I would ask them to speak to their provider. Receiving the health care that they have arranged for you or put in place for you is important. And we do need to look after other aspects of our health. People are still able to bring a support person with them to an appointment or procedure as long as they haven't been traveling outside. So I would suggest that there are ways that they can try and manage that anxiety, but trying to help people feel comfortable that the procedures are in place, people are being screened for symptoms, and testing is being done if that's necessary.
Thank you very much.
Welcome.
Laurent Rigaud, La Voix chrétienne.
Oui, bonjour, docteur Morrison. J'avais une question pour les voyages de la fin de l'année. Juste pour être sûr, les insulaires qui sont des résidents de l'île, mais qui vivent ailleurs, par exemple des étudiants, maintenant il faut qu'ils fassent une pre-approval pour pouvoir revenir à l'île. C'est obligatoire, même pour les résidents qui vivent ailleurs?
Oui, on veut que les personnes qui, peut-être les étudiants qui vivent ailleurs, fait l'application parce que c'est la chance de regarder leur plan pour isoler quand ils sont ici. Et puis, on veut faire attention à ces plans quand ils retournent. Alors, et puis, ça nous donne aussi, ça nous aide à voir combien de personnes qu'on a besoin pour faire les appels quand ils s'isolent, parce qu'on a besoin de beaucoup de personnes pour faire tous ces appels. Alors, il y a plus d'une raison qu'on veut qu'il fait l'application pour retourner ici.
Merci. Et juste une question sur le sport. Les Highlanders ont suspendu, enfin, il n'y a plus de match de hockey pour la Ligue junior majeure du Québec jusqu'à début janvier. Est-ce que tous les sports vont être sont à annuler, enfin toutes les rencontres doivent être annulées, même au-delà de la semaine prochaine, quand la bulle va peut-être recommencer?
Alors, pour les sports qui sont entre provinces, ça va dépendre de l'annonce pour la boule. Mais alors, à ce moment, on n'a pas fait d'autres décisions à propos des sports qui sont entre provinces, mais ça va être annoncé au même temps que, autant que on va faire la décision pour la boule atlantique. Et je pense que ça va être annoncé avant la fin de cette semaine.
OK, merci beaucoup.
Okay, merci.
Carrie Campbell, CBC.
Good afternoon. Thanks, guys, for taking our questions. Dr. Morrison, you said something to the effect that we would see the vaccine, the first dose of the vaccine, maybe, I think, a month from now is what you said. I just wondered if you could provide any more details around that, about kind of dates or numbers, or I know all this is in flux. Anything about the rollout, anything at all you can tell us about that?
Hi, Carrie. So, as I mentioned, everyone is looking forward to starting this process. So, we do not have confirmed dates of shipment or confirmed doses that will arrive, but as soon as we do, we will be sharing that. We are planning and putting all sorts of arrangements in place so that we will be ready as soon as it arrives, and to start having getting vaccine into people here in PEI, and recording and reporting it. And I think we are very fortunate that we will be able to do that, and that we can feel confident that we'll be ready to manage the vaccine as soon as it arrives. Of course, it needs to be approved by Health Canada And so there are a few steps that still are lying ahead, but we will be ready when it gets here.
Okay, and another question. I think we heard some of this in French, but I'll just ask again here. It'll be, I guess, sometime next week we come upon the 2-week anniversary since we suspended the Atlantic bubble. That was supposed to be a kind of a 2-week suspension, and then just to see how we're doing at that point. So I just wonder what discussions will be taking place between now and then. I wonder what sort of indicators you're wanting to see, and if at this point whether you think that you would be prepared to support opening the bubble back up.
Well, for the first part of the question, Carrie, there's certainly discussions that have been going on between the premiers in Atlantic Canada, between our office and the premier, and also those conversations starting with my Atlantic counterparts as well. And we would want to certainly let the public know that decision before the end of the week, so it's not right up to the last minute, but before the end of the week, because I think that'll be important from a planning perspective. We are looking at indicators of course, what is going on here from an epidemiological point of view and COVID and our capacity, but also what is going on in our neighboring provinces. And at this point, certainly there's cases that continue, and Nova Scotia has been very clear that it has community transmission there. So at this point, those discussions are ongoing, but we'll certainly see in the next few days.
Thank you very much.